This is what happens when there are too many people and not enough vaccine. Albertans lined up for hours for a flu shot again today. There are shortages in other places too, as Canadians flock to clinics. Good evening and thanks for joining us. Demand for flu vaccine has become far greater than public health officials expected, and now in some regions it's running out. In Alberta, a record number of people have already been vaccinated, heeding warnings that this year's seasonal flu, H1N1, can cause severe illness. Across the country, there are now just over 2,000 confirmed cases of H1N1, and at least 33 people have died from the seasonal flu. This afternoon, Canada's Public Health Agency announced it's buying an additional 500,000 flu shots to try to meet the demand. Mike LeCouture looks at where it's needed most.
Right now, you're going to be waiting until 4:30.
People in Alberta lined up for hours on this, the last day of the mass immunization campaign. But as the lines for the flu shots get longer, the supplies are running short.
I think it's kind of disappointing. You would think that they would be a little bit better prepared in this circumstance for something like this.
The problem is so acute in Saskatchewan, officials are only giving out the vaccine to those most susceptible.
Starting Saturday, January 11th, the health regions will be offering influenza vaccination only to children from 6 months of age to under 5 years of age and to pregnant women.
Meanwhile, a Manitoba family is mourning the loss of a 19-month-old boy. Kylan Primich's parents say doctors told them traces of the H1N1 strain were found on his lungs.
He went to bed the night before, happy, no signs of any type of symptoms of anything. And she went to wake him up in the morning and he was already gone.
The boy's family is now urging others to get the vaccine. In Alberta, a record number of residents have received a flu shot, but it's putting a squeeze on provincial supplies. Health officials there are closing these mass vaccination clinics at recreation centers and malls, but they are setting aside some doses.
Immunizations or vaccine will be saved for two groups, one being for outbreak management purposes, which is a medically needed purpose, and the other being to provide the second immunization for the very young children who do require that second dose.
At the start of the flu season, the spread of the H1N1 virus was sporadic, with just a few cases here and there. But over the last few weeks, the infection rate flared in Alberta, Saskatchewan, Nunavut, and central Canada. Those bright red areas are the regions health officials are most worried about. Provinces like Nova Scotia are shipping their surplus of shots to areas in need, but officials warn we are reaching a breaking point.
Supply is not inexhaustible. It's not like you can turn on a tap and flu vaccine just comes out from a big reservoir somewhere.
Health Canada has found 500,000 flu shots it can buy, but officials warn if demand in the east spikes like it has in the west, all those vaccines will be gone in no time. Donna?
All right, Mike, thanks. And if you're not sure about the symptoms of flu, we can help you. We've posted the difference between the common cold and the flu on our website, globalnews.ca.